Hello to everybody. Thank you again for joining, and we will go ahead and get started here. We are here to talk about male sexual health, maximizing erectile dysfunction, and other non-surgical penile enhancement treatments, and Dr. Torgerson's approach to male wellness with using CO2Lift. And so just going to go very quickly just for anybody that may be new to the product, and then I'm going to go ahead and turn it over to Dr. Torgerson. Just a little bit of background on what is CO2Lift. So CO2Lift, the company is Lumisk. CO2Lift is the product. CO2Lift Pro is what our providers are using within their practice for their patients. And that was developed in 2015. It is the gel delivery version of carboxy therapy. And carboxy therapy has been done for years and years, dating back into back in the day when Japanese samurai warriors would go into their carbonic hot springs to heal their battle wounds, and then developed into more therapeutic use with injecting the gas into the skin, more popular in Europe and in Asia and South America. Now we have the topical version of it. And so a lot of really great data and a lot of really great studies that have been done on the therapeutic use of carbon dioxide gas. We have the gel delivery version of it, of course. And so what happens is when you apply that gel, which contains the gas, it's going to go into the skin. So the CO2 is absorbed. Your capillaries are going to expand. We're rushing oxygen to the area. So you're almost creating a hypoxic state in the skin to allow the body to respond and rush oxygen locally to the area via the Bohr effect. So it is a very powerful tool that can be used for a lot of different ways. We do have a lot of great clinical background on the gel version itself, from creating instant hydration just after one application, improving elasticity, so helping with skin quality, and then also using it in combination with in-office treatments like your RF microneedling, laser resurfacing, so reducing downtime, using it with wound healing, so getting re-epithelialization after about a month of use on different cases like diabetic ulcers and venous ulcers, proving that we are increasing the oxygenation and the blood flow locally to the area. And then again, more popularly now being used by plastic surgeons for the prevention of necrosis, ecchymosis, hematomas, especially in body contouring and in other surgical procedures. So again, we have a very vast usage for the gel. It is very versatile, literally used from head to toe and everywhere in between. About 4 years ago, we had a physician, Dr. John Leonardo, who started using this for male sexual enhancement. And so I think since then, we've kind of started to gain a little bit of popularity on the usage of carboxy therapy, topical carboxy therapy for ED. And more recently, Dr. Torgerson has taken that to additional lengths, I should say. So with that, I'm going to turn it over to Torgerson. So just a very brief introduction to Dr. Torgerson. So he is a University of Toronto trained facial plastic surgeon with one of the fastest growing practices in Canada. From his state-of-the-art multi-specialty clinic, Dr. Torgerson has become a world leader in facial cosmetic surgery, injectables, minimally invasive hair transplant, energy devices, and male-centered treatments. He is passionate about safety and best practices, actively involved with several national and international complications committees. Having a broad research background, Dr. Torgerson has published extensively, traveled internationally, training, mentoring, and presenting new techniques and innovations. And we are so honored to have him here with us tonight. So I think it was just more recently that we came across Dr. Torgerson. Of course, we heard him at Hot Topics a couple years ago with his amazing techniques and results for male enhancement. And both Lana and myself, Lana is our CEO and I'm our senior VP at Lumisk. We were just enamored and in awe of the results of Dr. Torgerson and his techniques. And so to have him here with us this evening, sharing that with you, and then also that he is now incorporating CO2Lift Pro into his protocols is just such an amazing honor. So with that, I'm going to turn it over to Dr. Torgerson. Thank you so much. And I will let you go ahead and take it away.
Awesome. Well, I am super excited and jazzed to be here, and all things come together for reasons. Tonight, I want to talk about one of the most exciting new adjuncts to our practice. You know, cosmetic things have shifted and changed with the, economy, and certain things are getting busier, and we need to always be on top of what's moving, what's driving, and what do people want. And this is really, really true when we started thinking about our wellness division, and it really started taking off in the men. We started it with women. In fact, it didn't have any kind of lift that the male division did. And, we're always looking for best practice. We're looking for things to make it better. So tonight I want to inspire you a little bit and talk about why you're here, because you guys are sniffing the same thing that I'm sniffing, that the male business is a good business, and it certainly is. Males are fabulous customers. And so my wife and I crafted something in our clinic that sort of tried to make a little, mecca for males. The question was, what do dudes want? Well, we all want the same things, in fact, and males go through the same kinds of processes as we get older. And so we really, really tried to incorporate that under one entity. We called it Sovereign Male. And it was primarily around drive, form, and function. You can go to the next slide. So on our website, if you go to Sovereign Male, we say, for men, from skincare to performance enhancement, Sovereign Male is your kingdom. We have a phone app, we have an app on a website, and we really, really made something that was, from the moment that you went on made a phone call, you were spoken to by a male administrator. Once you come in, it's all male. Your nurses are male. Your environment is male. It's kind of like we did the same thing for females to try to increase their comfort level, because guys don't want to talk about this. These are great ideas, you guys. But you have to understand that a great idea can be at the wrong time. And this is a great idea at the right time. And so it's always about timing. And it's so true how that was. And so, because, we've been wanting these things for a long time, but we don't want to talk about it. So it's this little melange of having social media and having it open and having the right kind of environment. The men are actually okay to start talking about the things that bother them. And so that's why it's the right time. You can skip to the next one. Yeah. So basically the pitch is the best version of you: healthy, confident, spontaneous, consistent, legitimate, energetic, sharp, focused. These are the messages that we want to be giving our patients, because that's what they want. They want to feel all of those things. They want to feel like they used to feel like when they were 18, 19. All right, next. So why am I'm a facial plastic surgeon? How am I getting down into male bits? Is because I had a lot of experience with injectables, and we did lots and lots of injectables. And it was so bizarre how this happened. I was in Monaco at one of the big AMWC meetings, and we were doing a lot of PRP for hair. And the guy said, "Did you know you could mix this, and are you injecting penises?" And I said, what are you talking about? And then we did a lot of research on it. I took some courses, and we patented and trademarked some stuff. And so I've been passionate about injectables as just an adjunct to my practice for many, many years, and I'm on a lot of complication committees. And I've actually been in private practice for 18 years. Nadine told me to update that slide. So it's been a long time, but we can do things in ways that meet patients' needs. Sometimes surgery is what they want, and sometimes they don't want it. And let me tell you, for business, non-surgery is amazing because it's repeat business. You can go to the next one. So men's sexual health has a major impact on the quality of life and the confidence for men. Next. And so again, we centered our practice around drive, form, and function. I'm here to inspire you. You can center your practice however you want to, but that's what made sense for me. So let's talk about drive for a second. Drive is testosterone replacement therapy. So it's testosterone, and namely it's optimizing. The word is optimizing here because nobody has a perfect testosterone levels, and there's a range, and we want to be up at the high end of the range. And if we can be up at the high end of the range, then it's safe still. We have targets. If we have targets, then we can do it safely and avoid complications. We also do HGH. This is probably, everybody, one of the easiest ways to draw men into the clinic because they're looking for it. It's very topical. So you're like, well, how do I get men into my clinic to be able to do, enhancements? Well, TRT is a big one. I want to tell you that right now because it's cheaper and everyone's looking for it and it's safe. And if you can do it safely, you get men in there and it's repeat business next. So what are low test symptoms? Well, low energy, low mood, low libido, ED, difficulty losing fat, difficulty building muscle, and it's easy to treat and to maintain. Go ahead. What causes it? Well, mostly it's andropause. That's the truth. Andropause is the male equivalent to menopause. You can get it through lots of other things that you can see on my list. But in general, the big deal is that almost nobody has a perfect testosterone and all of them can be optimized. And the science shows that if you can do that and monitor them in a safe way, they feel better and you got a patient for life. And that's great business. They come back and they trust you, and then they trust you, and it's an open gateway to other stuff like wellness, like ED treatments and like male enhancement treatments. Next, so medically supervised, safe product from the pharmacy, safe dose to optimize testosterone levels, avoid risks, maximize gains. This is your entry point. It helps really. I mean, I just can't even tell you the amount of patients that are coming in, flooding in because they can't get it through in Canada, the OHIP system. But I mean, it's throughout all systems and it's hard to get it. It's getting easier as we go along. But if you can have an entry point, this is the entry point right here. Next. Okay. Form. This is the other piece of the clinic, and form is about penis size and scrotal size. We don't want to forget about scrotal size too, because that's why they call it a package. And we want to make sure that they both go together and they're well balanced. This is artwork. And so we did something very special next. We developed the Big Shot. We've trademarked it and patented it. And it's a combination of two natural things really that bring two diametrically opposed things together. Natural, long lasting. Natural, well, we've had fat, but to get volume with fat, you need a lot of it. And if you don't have good vascular abilities, it just mostly dies. Hyaluronic acid, is mostly done in LA or in New York, and you can get a whole bunch of Juvederm, but it doesn't last very long. You need a lot of it and it's expensive. It's dissolvable and safe. Excellent, but it doesn't last a long time. The other piece is, permanency. How long does it last? Can be safe and dissolvable, but if it's only lasting 6 months, then we have this big group of people looking up going to Colombia or Mexico or, Brazil, where they're getting injectable silicone put in there, or polymethyl methacrylate, or even the new Pneuma device. These are wrought with complications, and the biggest one is infection. Infection is a good standalone 30 to 40%. That's kind of a big deal. What are you going to do with that if it gets infected? I've seen it. It's a big chopperation. The other piece is, what if it's not perfect? What if it's asymmetrical and it's permanent? Again, a big chopperation. And so, you want to have something that has both. And that's what really the Big Shot is. The Big Shot isn't the P Shot. The Big Shot is increase in size. And we want to create something noteworthy that's safe and natural and lasts a long time. Go ahead. So what I promise is a longer and a thicker shaft when flaccid and a thicker shaft when erect. We're talking inches, folks. We're talking up to 2 inches of both or even more. Now, it's a non-surgical procedure that we patented. It is something that takes me about a half an hour to do. And you do mostly, when you're erect, get gains in girth. We can get 1 to 2 inches in hard length gains as well, because we inject above the ligament at the base and in the tip. So we pitch it as both. So I kind of say bigger. But I inject more volume probably than anybody else in North America in terms of how much I'm injecting and also number of patients. So it's a big deal. We have patients coming from all across the continent. Go ahead. The little video to see that there's some nuance to this. You can press it You can do it in both circumcised and non-circumcised patients. Injections, volumes I'm injecting are anywhere from, 50 overall to up to 200. The nuance here is that we have a nice harmony between shaft and tip. We inject in both the shaft and in the tip. I injected over 2 sessions, and one of the reasons that we got, and I'm so excited about the CO2 Pro lift, is because there's obviously a lot of swelling that goes along with this, and we get better, faster results with the Pro lift if you can put it on. And I'll tell you our protocols, and I'll tell you why it's exciting to be able to incorporate CO2 Pro lift into my big shot, because isn't that crazy how much of it is turtled up there? Again, a beautiful harmony. This is a game changer. And this is really the male equivalent of a breast implant, the #1 cosmetic procedure for women on the planet. It's about enhancement. And everybody thinks this is about sex. This really is a little bit about sex, but it's mostly about legitimacy and feeling great in your own skin. We're next, patient. Here's a few other befores and afters to show. We can go into the next slide. That why I think that the big shot is the ideal technique, because it's natural, because it's low risk. You can get these products, which is a combination of PRP mixed with hyaluronic acid. It's readily available, it's reversible, and it lasts a long time. It's degraded probably around 10% per year because of the natural stimulation of your body's own collagen. So what happens is in both the shaft and in the head, you're getting this buildup of collagen. Well, guess what CO2 Pro Lift does? It stimulates more collagen, okay? So this is why it makes sense for me to incorporate this into my practice, because it just enhances what's already happening, something that's, is why it lasts so long. And yet we have this natural reversible phenomenon where I can adjust it. So it's the best of everything. Next slide. So who's a good candidate? Basically every general healthy adult. I like to do them over 18 years because they can handle it emotionally. Doesn't matter if you're circumcised or uncircumcised. If they had a mineral peroneus or suprapubic fat, these are other things that come into the mix, but you can treat them for sure. Obviously, if they have reasonable expectations as well. Awesome. Next slide. I'm going to answer questions towards the end. I'm happy to. I promise I'll try to get to all of them. So again, the Big Shot treats both the shaft and the glands. It's important because this is artwork, people. We want to have beautiful looking artwork that looks good when they're soft and when they're hard. Go ahead. And of course, we want to tell you that this product gets injected above the corpus cavernosum and spongiosum. So it's incorporated with a cannula above the tunica albuginea that encapsulates that, so we don't get into blood vessels and get vascular occlusion. It's injected underneath the skin so that it doesn't affect the sensation, and that's important about both the shaft and the head because they're different. It takes me about 30 minutes to complete, pains minimal, no sex for 7 days. And that's really, really when we want to incorporate the Pro Lift within that first week to help to maximize both the microgenesis, as I talk about ED, but also angiogenesis, but also the collagen that's forming, which we know that it does, and some good evidence of that. Next slide. There's some good befores and afters as to the significance of where we can go. And this is significant in both the artistry of it. I can make a crooked penis with peroneus be straighter because it's thicker. And there's some beautiful, beautiful harmony between shaft and tip. We want to do things and create things that look natural. You can see some of the pokes of where that cannula goes in as well. Again, this is probably the worst circumcision ever with that ropiness, but yet it looks so much younger and more youthful. Go right ahead. Wow, here's another good example. Most men are like women in that when they get something like this done, they want a natural looking penis, but some men want the equivalent of women's stripper boobs. And, in general, it's okay. I always say I'm going to be your best friend very quickly and I'd rather build it up slowly. It's better to do it that way. But when they see the difference, it's quite noteworthy, and we can go for inches. You can show the next one really quickly, just some quick examples. samples. Again, from the side, straighten this penis out. It looks natural and enhanced. And of course, it works perfect. This is a patient who decided to upgrade. So came back after about a month and said, love it, love it, love it. Can we go a little bit more? And you can see adding a little bit more volume makes a bigger enhancement up to a certain level. And then you're going to start to football this penis next. And, it's not just longer, it's thicker and less veiny. And so they look a lot healthier. They look a lot younger. They look a lot straighter, which is awesome. Next slide, please. Good. I just did this one recently and just showed this one in Vegas. I think it's a really nice example of a natural looking enhancement. Good stuff. Next. So, Lauren also talked why would I want to do this? Well, in general, it makes more collagen. It makes more vascular tissue. It helps to decrease the downtime. It helps to decrease the discomfort. Oxygen is good. This is a mini hyperbaric oxygen treatment. And, as probably most of you know, we're all trying to get a hyperbaric bed. I'm in the works of getting one as well. But to do a topical one is no brainer, folks. Better healing, faster healing, better results. Next. So I think that's probably the next slide is that, it's easy to put on. It's easy to apply right after my injections of the Big Shot. Yeah, I'm going to mix it up and show them how to do it. And we just need it on for 45 minutes. That's all. They can come home. And by the time they get home, they can take it off. It helps to decrease the bleeding in and around the needle pokes, which is awesome because there's always a little bit. And then it's just daily. And then they get used to mixing it up and then just putting it on, whether it's in the evening, leaving it on all night. It just needs to be on for 45 minutes. And so we have them do it daily for 5 applications altogether. Next. Yeah. So again, the effects of carboxy therapy, multiple ones here that I'm interested in specifically for Big Shot, actually are all of them, because they all help with improved tissue health and connective tissue health. And then it's going to, I just started using it, folks. These are my preliminaries. I'm just going to tell you this, but they've all been really, really positive. And, I've been using it also in my facelifts. And of course it's for wound healing. And so this is an active wound that we're injecting. So again, it makes sense. Next. Okay, good. So some of the clinical data, increased hydration, luminosity, radiance, decrease in sagging. These are all good. Increased reepithelialization. Not so as important in this case since it goes in with a cannula, but reduced downtime and speedy healing. And that's what they want because there is swelling and there is a process during the couple of weeks where the patients need a little bit of hand holding, and hand holding is much easier when the downtime goes down. Next. Great. So I did a little study, and studies are good. So here's my little 5-patient study. I did real world pre and post treatment survey data from 5 males. I did it on 5, and they were a variety of ranges. So 24 to 77. They all had the Big Shot procedure. And then we just did a little bit of, a Likert scale, rank your outcome from 1 to 10 before and then again after at a month. So they all had the Big Shot and they all had 5 treatments of the ProLift along in their healing go ahead. So again, the ProLift was applied daily for 5 days during the healing process for a minimum of 1 hour. I just used a paired sample t-test to compare them. And we can see the results here were absolutely astounding. Next slide. All patient recorded outcome measures significantly increased, not just 0.05, but by P as 0.00, both in self-confidence, pride in body image satisfaction, sense of masculinity, confidence during intimacy, overall quality of life. It was huge. It was a huge increase in their reported outcome of how they felt about themselves. So we're affecting, a little bit about sex. No, we're affecting their body image. We're affecting their overall quality of life. So, you ask, who did your rhinoplasty? Well, I did it, but maybe they might forgot because I fixed their penis and I made it bigger. And that's kind of a big deal. And are they going to come back when it's down 10% the next year? Yeah. they're going to come back for a top up over and over and over again, and they're going to be your best client. This is good repeat business, folks. It's safe, and it's a way that we can speed up healing and give patients better results. That's all I care about, because they're going to come back to me and not you, because I have better stuff than you, right? and so this is what we want to do. We want to choose the things that make sense, that help to increase healing and make our patients happier and make their results more consistent and more safe. Next slide. So the big shot, another happy patient. Next slide. All right. Last one is function. Well, function is important, because if you have a beautiful penis, but it doesn't work, who cares? So, we know that sexual performance is a really, really important piece of it. And we offer this at our clinic. I can tell you that 80 in a new statistic, 80 to 85% of men over 40 have some form of ED. That's a big deal. And I know that 85% is related to vascularity, decreased vascularity. So we're talking about hardness, and we're talking about longevity. All right, next slide. So how do I do this? Well, in my clinic, I use a variety of things. We don't use the drugs, although the drugs are Band-Aids. I try to do a little bit more. We use a combination of shockwave therapy, which I'm going to tell you a little bit about, PRP, known as the P shot. That's proprietary, so it's just PRP. But of course, this is PRP in the vascularity, in the vessels that we're injecting, not around the vessels. So it's different. And now we've started to incorporate CO2Lift Pro, not just as a healing mechanism, but as a stimulating mechanism. So this is different. So erectile dysfunction is a huge problem. Next slide. Sorry, I said 80. I got it wrong. It's 50% of patients over 40 to 70 have ED. So it's either mild, moderate, or severe. And we want to treat the milds and moderates, not the severes here. So it's starting into men of their 40s. Why is it earlier? Well, I think men are more aware of it, and I think they're talking about it more. And so I think, we see andropause really starting in their 40s, and decreased testosterone is a big part of andropause. Decreased testosterone is a big part of andropause, and erectile dysfunction is a big part of andropause. And so that's why we're starting to see it younger and younger. And so again, we think it's probably about a lot of studies showing that people are just more aware to talk about it. Next slide. The primary causes, again, are vascular. So we see increased 3 times causes in vascular things like diabetes, and 2 times in alcoholism, and two times more common in high cholesterol and high blood pressure and obesity and cigarette smoking. So these are all leading to, vascularity, microvascularity problems where the vessels are getting plugged up. Next slide. All right. So atherosclerosis is what happens, where we're getting plaques forming, less blood going into the penis, less blood in the penis, less hard penis. There we go. Next. So it's not like flipping a switch. It's not on, it's not off. Next slide. ED is kind of there's a score. It goes from 1 to 4, from a tofu all the way to a cucumber. And so we want to be treating the milds to the moderates. Those are the best ones, because you'll get the best results, right? So, in the 2s and the 3s are the suboptimal ones, and the moderate ones where it's hard, but it's not necessarily hard enough for penetration. Starting at the beginning and treating the tofu penises are going to be the hardest, and they may not be your best results with this kind of technology. Next. Again, 2 or 3s are the best. Next. So ED treatment is, something that, we have repitched and re-languaged. Because anybody says, do you have erectile dysfunction? The answer is no, I don't. It works. And they're probably right. So we talk about performance enhancement, and performance enhancements, everybody, because who couldn't have a harder penis or a longer lasting erection? And that's really the language that we want to talk about. We have changed ED treatment to being about performance enhancement. And, women want their men to be highly performing, and men want themselves to be highly performing, so it makes sense. Next slide. So the shockwave treatment is great because it's non-drug, and it's actually not a Band-Aid. You don't have to take it. each time you want to have. So there's no surgery, there's minimal side effects, it's non-invasive, it enables spontaneity, and it addresses really the root cause, where drugs, that just vasodilate do not. And it's obviously quick and non-surgical and non-pump and non-injection next. So we've done really, really well. This is one of the only Health Canada approved devices. I know that you in the States, you might have some more. Biossure in particular, by Cynosure, is better than the other devices on the market because of its design. Next, we'll go over this quickly. And the shock waves basically increase blood flow to the penis. Not only that, the other cool thing about these acoustic shock waves, which are sound waves with pressure, is that they also stimulate smooth muscle damage. And the smooth muscle goes down as we get older. And as we get older, there's less smooth muscle, which means that it's not able to hold the blood in the penis. And if you can't hold the blood in the penis, then your erection length is low. So it's really, addressing all the major causes of vascular related ED. Next slide. And helps. I love the fact that this treatment has no downtime, doesn't hurt, it's well tolerated. And it again increases my male business. So why did I want to add or think that CO2 Pro Lift would be better? Well, because of microvascularization. It's stimulating new blood vessel growth. And so that's really me getting a better result for my patients for ED. That's why it makes sense. Next slide. Good. So neoangiogenesis, procausis, microcirculation, growth factors, flow motion, vasodilation, all the things that carboxy therapy is great at doing is what I want. And I want that for my results to make my ED treatments, male treatments, better. Next. Good. So again, I did a little 5-person quality study design, and I used it with my Biossure treatments. After each Biossure treatment, which takes 15 minutes, we do them 1 week apart, and we do them 6 times. All right. This is also repeat business because at the end of the year, we're going to do 3 times. So I had them put on I put on the first one and then the subsequent 6 ones after the Biossure treatment for a minimum of 1 hour, and then they could peel it off. And then again, I just asked them for, at the end of their 6th, the qualitative treatment at the end of their treatment regimens as well. And these are some of the highlights from the open-ended comments. I feel more masculine and proud of my body. My self-confidence in intimate moments skyrocketed after Shockwave with CO2 Pro Lift. Before I was hiding, now I'm confident both socially and sexually. This procedure was life-changing. I feel emotionally balanced for the first time. This is qualitative, folks. These aren't, measures of erection strength, but, in the end, it's always going to be qualitative and it makes sense. So these are the things that I want to incorporate into my practice because they help get my patients better results. And I want to do whatever I can to be able to get them a better result in a safe way that has backed up with science. And I was so excited that not one patient said, no, I didn't really feel a difference. So it's about picking your patients. And it's about offering them. The nice thing is that it doesn't add a lot of money to each of the patient treatments. For each patient treatment, it's about $135 Canadian that we add on to it. So it's an easy package upgrade, and we just kind of add it to it. It's not a big deal. They're committed. They want the best results. And so that piece hasn't been a hard sell as well. Next slide. Oh my gosh, we went through that in 40 minutes. That was great. If you want some more information about CO2 Pro Lift, or the next slide, and some answers to your questions, I'm going to do that, or the next slide. Oh, we didn't have the next slide. So if you want to know about it, it's thebigshot.ca, and you can find more information about that as well. But we'll keep it to ProLift since they paid me to be able to do this. I'm just joking. Awesome. I actually wasn't paid to come to the first meeting, and I was so overwhelmed by the science of it that I'm like, I got to try it. And here's a great application. Am I using it surgically? Yes, I am. Am I using it personally? Yes, I am. Is my wife using it? Yes, she is. And are we getting also a hyperbaric breath? Because I believe in it. So, I think that's the most important thing. When you connect with CO2 and they're a great team, you need to believe in it, and you need to be convinced why it makes sense, and you need to see it working faster. I just did some CO2 laser around my eyes, and I'm on my third or fourth Pro lift, and everyone's like, wow, it was like 2 days and it was like such a fast heal and it's been great. So I'm hiding behind my glasses a little bit, but I use it personally. Let's get to some questions, Lauren.
I love it. I know I have like so many questions, but I'm definitely going to make sure that we address all the audience's questions first. So first is from Emily. So you're mixing PRP with filler. Which filler do you offer trainings on this
So the
procedure?
answer is it's a little bit proprietary right now. You can do a combination of lots of things, but we've done patenting, and so the answer is go on thebigshot.ca. We do offer training. We do give you our secrets. We do give you the beauty tips and it's artwork, and we're working towards that. But the answer is it is a high concentration, which means 25 milligrams per milliliter hyaluronic acid mixed in with a certain level of PRP. So I can give you that information, the techniques and how we do it. We train, and we're passionate about getting it right and getting it perfect.
Someone had asked about pure easy gel instead of pure.
Yeah. I mean, I think there's a lot of different ways that you can try to mix it up. We've just had our special way, and I think PRF probably would work. I don't have a lot of experience with PRF mixing it with this, so I won't comment, but we get some pretty consistent results with the PRP. But there's lots of different combinations, and I think if you are actively using it and you get great results, then I think you should stick with it.
Love it. And then about how much are you charging for the procedure?
That's a great question. I would say that it's the most profitable thing that I do, more than surgery, more than hair. I have one of North America's biggest hair transplant clinics called Toronto Hair Transplant Clinic, and we do so much volume, but I still make more money off the male stuff than I do off anything else. So it depends on the patient, anywhere from 5 to 20K.
Wow.
And then there are repeat business that come back because males don't like when it goes down.
And you were saying that it's like they'll come back for a refresher in about a year.
Yeah.
So you do like a percentage of a fee then for that.
No, it's all starting from it's a percentage. They don't pay as much money. Yes, correct.
Okay.
Yeah, 100%.
That was, they said, and what if they want to keep adding and adding? Is that?
Well, I mean, they can add, but then it's going to be about your reputation and how you go. And yes, you can. But I mean, I told you an estimation of the volumes that we're doing in terms of anywhere from 50 cc's of product up to 200 plus. So, I had a patient who came back from London, England. He didn't know that I did it. I had done his eyelid surgery, and he's like, "You did this? I can't believe it." Well, they put 6 cc's of Juvederm. Well, I couldn't see where it was, for example, because I was like, well, you paid a lot of money, but I mean, you can't see a result. So we did the big shot on him, and he was delighted because we did something so noteworthy that actually made a big difference. And that's what you want to do. You want to go above and beyond. You don't want to just sort of underwhelm. And in the end, you need some volume. But you need volume that sticks around. And that's why this makes sense.
Mm-hmm. Yeah.
And we're pitching this like a breast implant. So the prices are in keeping. This isn't lips, ladies and gentlemen. We need some volume here. Mm-hmm. And that's one of the reasons why fat doesn't work, because if you get it in volume, it just dies. But this doesn't die. In fact, the CO2 Pro Lift makes it better. It makes it last longer and get more collagenesis. So it makes sense to me.
That was obviously you just started using this, but of course my brain was thinking about the longevity of the treatment, and will that be bad for business? Maybe that they're not going to come back as often if potentially this can help extend. Life.
After 2 years, you don't really see them. It's so congealed, so stabilized. So you kind of got them for a couple of years because the bringing it back really, really stabilizes it even more and more.
Mm-hmm. That's great. That's awesome. And so what are some of your common objections that you might be getting from male clients, and how are you addressing them?
Sort of objections as to what they don't like about the product?
Maybe this is from Valeria, so I'm not sure if she wants to expand on that or not, but I guess maybe more just common objections like to actual injections versus other therapies or whatnot.
Well, I mean, And so here's the deal. I think that nothing is perfect, but in the realm of male enhancement, and I think that's what we're talking about, male enhancement in the big shot here, not ED treatments, that, in general, surgery has been abysmal in terms of a cosmetic result. It's been more like I'm rescuing a penis from, it being, having a terrible circumcision to having an accident to it not working at all. So surgery as a beautification, even a lengthening, cutting the suspensory ligament has been underwhelming, and it has a long history. Unfortunately, lengthening the ligament, suspensory ligament, and we've got some good data, is not one of those things that people want to come back for, because it doesn't lengthen it very long. There's, it can to potentially shorten it. In fact, they'd have to do spacers to keep it, and then the direction of it goes down. It doesn't go straight out. And so surgery in terms of trying to lengthen the corpus spongiosum doesn't work. I was just in Vegas speaking with a urologist. And so from a surgical point of view, it's not a beautification thing. So non-surgical procedures have really, really taken over in terms of making it look better. And so it tends to be what patients want as well, because it decreases downtime and risk and complication. And so it's just getting it right, getting it so that it actually lasts long enough, has the right feel, and, potentially can be reversed if the wearer or the wearer's partner doesn't like it. And so it has all these wins about it. And so if you can get in there, Valeria, it can be the best thing ever, because it lasts long. It offers what it produces, what it pitches, which is length and girth. And the feel is great for the patient. And if they decided that they didn't like it in the end, it's not something that they've really messed up their junk with. And so the objections are low because it works, because it's low risk, and because it does what it says.
I love that. And she had also asked about marketing, which, you obviously have a very extensive brand and a lot of brand awareness out there. You have your hair transplant. I would imagine there's a lot of cross-pollination. RT, which you said is a very easy way, but someone that's a little bit more newer to it, what would be your one tip for them if they're launching this, and how to market it to clients?
Yeah, well, that's a great question. In fact, my strategy is join a team like mine and help me to be able to use my brand to be able to help to grow your brand. I think, that's one strategy. But the other strategy is, have entry-level pieces. Men are pretty consistent. Have ways to get them in. It's weird, Lauren, because, you think of cosmetic clinics being primarily driven by females. Mine has switched in the last 2 years, where my whole entire clinic is driven by men, whether that's hair transplant or men here. It's astronomical how like crazy how that's happened. We've had this switch from females to males. So, I've thought about it very, very, very specifically. I've changed, who I hire and who enter. There's just these little things, who answers the phone, because I know what's happening, and I'm trying to accommodate that. So I started just with common sense stuff of what would I want as a dude to be able to, I don't think you should have a female nurse injecting this at the beginning, and, until your practice is super extensive, because the guys are going to be nervous about it, or just depending on what your practice is like. So I've switched things around and rejiggered things, but I think probably for me, the most important thing was having entry level things that guys can easily switch over for, because everybody thinks that male enhancement, like the big shot, and is very niche. It's becoming less niche because of the time. And guys are looking for it more now. At the beginning, it was all on these weird kind of, social platforms of discussion groups, and they were odd men. And now it's, I just did a big ad campaign on the subway system where we're talking about the big shot. Really? The subway system in Toronto? Yeah. And so it's at that point too, where we're like, yeah, we can advertise on, in a wall of the bathroom in the Scotiabank arena, where they're doing basketball or hockey games, because guys are kind of interested in thinking about this stuff. So use your creativity. I'm trying, We're all trying to grow this, but I mean, I will tell you that it's been a pretty exciting go so far in my male business. And it again is somebody said, I want to learn from you and I want to learn rhinoplasty, but what would you charge me? And that's it. And don't you want to not give away your secrets? I'm like, I don't make very much money off surgery, just so that you know. It doesn't really bother me that much. I hope that answers your question, Valerie. Yeah, and I hope I sort of said it in a roundabout way. And if I haven't, please ask for clarity.
I think that's crazy. I remember, oh gosh, it was maybe like even 10 years ago, Grant Stevens was talking about, it was with Cool Sculpting, and he created like a man cave, and it was a whole, male separate part of his practice. It's crazy that you've now shifted your whole patient demographic to majority male. Did that affect like kind of the aesthetic of the practice as well?
Yeah, I mean, yes and no. Like we have it for me right now, it's just about having something beautiful and creating something. Guys like the same things as girls. They like things to look good. We're visual. And so, but yes, we've added things that make it a little bit more male centric and not necessarily den-like, but I mean, I know there are clinics that are that way for sure. For sure. They make it more like a den. And maybe in the next iteration, when we expand and do just the sovereign male clinic standalone, it will be that way. I think that's a fabulous idea. I'm going to write that one down.
Is sovereign male, is that something that you're looking to franchise too? And is that
for sure? Yeah, for sure. Yeah.
That's great. So yeah, someone had asked if you offer trainings, and that's to go to thebigshot.ca.
Yeah.
Inquire about upcoming trainings. Someone had asked about exosomes. Do you incorporate exosomes at all?
Yeah, I mean, I'm all into exosomes. We're very, very much in touch with Drew Taylor at Acorn, and he has something even more powerful, which are the bespoke growth factors called secretomes that are your own. And of course, because they're your own, you could inject them. And we pluck hairs from the back and culture the stem cells, freeze them, and then those growth factors, which are anywhere from 3 to 55 times more powerful than exosomes, can be injected wherever. Of course, they're growth factors, and growth factors are great because they can be added to the mix, your own mix. So my yes for exosomes, whether they're bovine, which is the ones that we use, or they're your own. I think they're topical. You go to these meetings and it's all about that. And but this is something a little bit different. Hyperbaric oxygen fits so well into a wellness clinic, and this is what this is all about. It's easy. It's take home. That's the value in this specifically. And so I think a little combination of everything. Today, I consented a patient for a facelift brow lift with laser, and I had my order not come in yet. And so I had Lori in Canada. She Ubered me some because we're going to be doing it, in a day. And so it was an easy pitch sell. She wants the best results. And so, this is something that she wants to do for 5 days after her surgery. So these are easy ways with this Pro Lift to be able to enhance and maximize results. She's not doing exosomes, but she actually chose this one over PRP that we slapped, where we could put on her face, with exosomes, which we mixed together from a value point of view, which was interesting. From a value point of view, because it was about half the price. Yeah. So these are all important things that, need to be incorporated into our decisions. This was the CO2 Pro Lift was half the price as PRP exosomes. So she chose that one, and I know she's going to get a great result with it. So I said, yep, that makes sense to me. Let's do that.
Mm-hmm. I love that. Thank you. There were a couple other any concern with PRP and lidocaine from the HA filler, knowing that lidocaine kills the growth factors in PRP or PRF.
Yeah, I mean, it's a consideration. I know people are talking about it. I don't know that the volume of the lidocaine that's in the product is problematic, just in terms of the longevity that we've seen over the years. We've been tracking this over 12 years. So the answer is I don't think it's problematic in this case. I think what might be problematic is when you're trying to freeze the penis, that you use too much. So, that might be an issue.
Mm-hmm. And then our same attendee here, Josh, had asked any viewpoints on trials with Sculptra or Belafil instead of the HA, or any biostimulators instead of an HA, or is
Yeah,
that?
I mean, I think, issue for us using that kind of a biostimulator is that they're much more watery. And yes, you're getting collagenesis forming, just the predictability of how much and where has been, I think, might come up with some challenges. And so it's more about the viscosity or the rheoscopy of the product, or rheology, in other words, too, that, helps give me that feedback as to how much to use. But I'm sure they're happening. I'm sure people are doing it. And I think it's a great question. I just don't have the answer to that at the moment.
Perfect. And just my own personal question, just from a protocol perspective, are you putting on a plastic wrap and sending them home, or are they sitting there
Yeah.
for 5 minutes?
No, we put on a plastic wrap and put it home. We would do that kind of anyways, wrap it up anyway.
Mhm.
Putting on a plastic wrap is just a practical way to keep it on without messing up undergarments.
Okay, great. And like ease of use, like any feedback specifically from the patients, like did they find it easy to use? Was it difficult? Was it something that they felt like they would continue to use as well?
Yeah, I think number one, it was easy to use. It wasn't difficult. I think that wasn't an issue. And I think mostly for the 5 patients, at least then, it was something that was associated with, especially for the big shot, a post-healing protocol. Certainly the discussions of just having it for overall longevity, I think, goes into the Viasure one. And then of course they come back for that. But certainly this is something that could be used for ongoing, microvascularity and collagenesis as well. And I think that's a great thing where you could do it a couple of times a year, match it with your treatments, or just on its own. Absolutely. Great point, Lauren.
I love that. Thank you so much. And thank you for your time. We're at exactly 1 hour, and I appreciate you sharing this hour with us. It's been amazing. And just to think that it's only been however many months since you started. You
Right?
So very excited to see what's, more to come and all the new great results. I feel like you are such an amazing innovator. I feel like, I don't know, you might be uncovering some more fun things for us here and some more fun combinations. So
Amazing.
thank you so much for your time. We very much appreciate it.
You're
And
welcome. And thank you for everyone's questions and interest. And I hope that was something that inspires you, because it should. This is exciting. And these products to market, make us all better. And this is one of them.
thank you so much. And for those that might not be watching live right now, and if you have any additional questions, you can reach out to us via DM. Dr. Torgerson, is there a specific place where they could reach out to you?
Yeah, just on Instagram is easy. Yeah, you can DM me at Dr. Torgerson. You'll find me easy peasy. Dr. Cory Torgerson. Yeah.
Fantastic. Well, thank you all. Have a fantastic night, and we'll talk to you soon. Thank you very much.
Good night, everyone. Thank you.
Bye. Bye-bye.